because time limited, and also could cause rising urban crimes. We also have data to show that, and of course, particularly in India, we know that the expansion of slum, once you have a lot of people sort of flowing into the major cities. So we do realize there are many challenges associated with urbanization, despite the fact that urbanization may actually help to solve the inequality problem. So I'm not going to show all this data, but I just want to finally bring your attention to this project we're doing, ADBI project. We are actually just about to start. The project is very simple. We try to ask the question, or address the question, can urbanization lead to a better quality of life? And in that context, we're doing, first, we want to look at the relationship between crime and urbanization, because we know urban crime is higher than rural crime for good reasons. But this higher crime may be due to higher inequality in urban areas. Whether it's urbanization itself or it's due to higher inequality in urban areas leads to higher crime, we don't really know, but we need some research. And I can tell you there's relatively much less research on this issue. The second one, as I mentioned, environment, local and global pollutions are very serious issues related to urbanization. We really want to dig into that and what's the relationship between urbanization and the environment, various different environmental indicators. We also want to look more now. I just did some work on China, but what's that kind of relationship for India? What's the relation for Indonesia, Pakistan, Bangladesh, and so on? We can try to also work on this inequality issue with urbanization for different Asian countries. And finally, we want to look at what's the impact of urbanization on health, and that's our very next sort of a presentation from ADBI. So with that, I just want to conclude, if Asia and India and China, individual member countries, can manage urbanization to achieve a safe, green, inclusive, and healthy urbanization, the rise of Asia will be a reality. Thank you.
Thank you, Dr. Wan, for sticking to your time frame. I now request Dr. Helble to make his presentation because we are very short of time. So 20 minutes? 20 minutes?
Good afternoon. My name is Matthias Helble. I'm a research fellow at ADBI. And I would like to take the next 15 to 20 minutes to present some of the research that we have been doing over the last months on urbanization and health inequity. It's a very new research, and I would just like to give you a kind of an overview of the main results that we have been finding so far for the case of Indonesia. So my content is straightforward. I talk first about the interlinkages between urbanization, income inequality, health inequity. Then I present the case of Indonesia before concluding. So, as you have heard in the presentation of Guanghua, these linkages are quite complex between urbanization and income inequality, health inequity. But we think it's very important, and I retrieved the message by the G20 presidency of Turkey that says we see rising inequalities as a major problem among and within the countries. In order to address inequalities, we placed inclusive growth at the heart of our agenda. We believe reducing inequality will contribute to social cohesion and inclusive growth. And our study, just to preempt one of the main results, is that indeed it's very important to have reduced inequalities because indeed they contribute to social cohesion and more growth. So if you look at now this complex relationship, there has been a lot of work done to uncover the relationship between, for example, income and health. The relationship works in both directions. Better health helps you to increase income, and income helps you to improve your health status. Then also a lot of work has been done on income and income inequality. We also have work on income inequality and health inequity. We find that more unequal societies have also more unequal health outcomes and worse health. And now comes this big trend, which is urbanization, that will influence all of these four circles around. when we talk about health equity or health inequity, that WHO says that health inequity should be defined as avoidable inequalities in health between groups of people, within countries or between countries. So they put the emphasis on avoidable inequalities. So it's not about have a genetic preponderance for certain diseases, but it's more related to social and economic circumstances. I would like to quickly go through the linkages where we have a lot of empirical evidence. One is about the absolute income, how it can health. That is very straightforward, and it goes back to the 1970s. What's less straightforward is the so-called relative income hypothesis, because it says that people who feel more economically disadvantaged, they feel more unhealthy because this inequality causes stress and depression. And for this conference, I put together here the inequality in the G20 and the infant mortality, and you see a pretty straight relationship between an increasing inequality leads to also an increasing mortality in the G20. So why is this the case? The experts, they argue that a more equal society will also lead to a more cohesive and a society with better social relations. And what's less clear yet, and there's still research going on, is what is behind these psychosocial processes that lead to kind of social deprivation and also worse health outcomes. And there also have been studies that show if we would reduce the Gini coefficient in the OECD countries to below 30, we could save about 1.5 million of people. So now, what is the link between urbanization and health? And I think this is a very important one in Asia, because we see a lot of urbanization going on. Asia is very much behind when it comes to urbanization. So we know from the public health literature that if urbanization is badly planned, and if it leads to insufficient housing and poor sanitation and also urban crowding, it will lead to the spread of infectious diseases. It increases the mental disorders and also leads to more violence-related disabilities. In addition, now we observe in a lot of Asian cities the level of air pollution is high, as well as the indoor pollution. What's also very important is that moving into urban centers triggers a change in lifestyle. When we move to urban cities, usually we take on a more sedentary lifestyle. There is less physical activity that we do. Often also the rates of smoking goes up, the harmful use of alcohol, and also a change in diet, which is often a more unhealthy one. So this leads also to a surge in non-communicable diseases. On the other hand, urbanization can help to improve health, because normally it means that I have a better access to health care services and also to medicines. It means also that normally I have better access to education, and we all know that education is an important determinant of health. It could also mean better access to water and improved sanitation. And normally, as Guanghua also alluded to in his presentation, if you urbanize, normally income increase, which could also provide a positive impact on health. So as a first approach, we thought, let's look at the case of Indonesia. They have a very extensive household survey and look at whether urbanization has led to better or worse health outcomes, and also whether urbanization results in larger health inequities. And we try to uncover the main reasons behind these rural and urban health inequities. So Indonesia has a very good household survey that has 4 waves that started in 1993. We're currently putting together all the data for the 4 waves. So this results are just for the latest wave for 2007, 2008. We have in this wave about 30,000 individuals representing about 80% of the Indonesian population. And for our study now, we only took the adults between 20 and 69. So we had about 10,000 adults in rural areas and 10,000 in urban areas. So the main variables that we were interested in were, because we were interested in inequities, we looked at the expenditures and wealth, because we want to give this gradient according to the income. We looked at underweight, overweight, obesity, and then also 10 chronic conditions. As a methodology, we chose the so-called concentration index, which basically is used a lot in public health and is very similar to the Gini coefficient. And then we also work with concentration curves, and we try to decompose the concentration index. But first of all, very straightforward, the health conditions in Indonesia, rural versus urban. We see that people in rural areas, they suffer more from underweight compared to urban areas. However, urban areas are more prone to have overweight people and obese people, and also they suffer much more from chronic conditions. And here we look at the question of underweight, overweight, and obesity, and divided the sample into rural areas and also the income quintiles. And as you can easily see, there are differences between the income quintiles when it comes to these three risk factors of underweight, overweight, and obesity. So the blue bar shows the underweight, and we see that poor people both in urban areas and in rural areas are more likely to suffer from underweight. On the other extreme, we see that the number of people who are overweight are more likely the people who are very affluent, and so there is a big increase, especially between the fourth and fifth quintile in rural areas. And then what came to a little bit of a surprise to us is that when we looked at the chronic conditions, we see again this disparity in health, that the more affluent people suffer much more from these chronic conditions. We didn't expect that it's such a big difference between the lowest and the richest quintile. And just to show you the different chronic conditions we looked at, it's diabetes, asthma, lung conditions, cancer, etc. We see again that the more wealthy you are, the more likely you suffer from one of these chronic conditions. Now, as a first step, we thought, let's look at the difference in income inequality, rural versus urban. And we see that between the two, there's not much of a difference. So in both areas, about 20% of the people, they earn more or less 50% of the income. When we look at wealth, and wealth we defined as all assets that the person has, we see that is a more extreme distribution, and we find that about 10% earn about 50% or own about 50% of wealth. Now we thought it's interesting to look at the health outcomes, and we see that, and this is very intuitive, that the poorer you are, the more likely you suffer from underweight. And on the other hand, we see, so all observations that are below the diagonal are basically showing that the wealthy are more concerned about these diseases. The more wealthy you are, the more likely you suffer from overweight. And especially for the chronic conditions, we have this positive concentration index, which shows that the affluent people are very much victim of these chronic conditions. Then we try to decompose it, and for example, for underweight, we find that the access to water, so this is the blue bar, is very important to explain why people are underweight. So if they don't have access to clean water and to sanitation, it contributes considerably to underweight. Overweight, when you look at the yellow bar, you see this basically says that if people have a fridge and electricity, and this unequal distribution of fridges and electricity explains a lot of the overweight, so people can store food, etc. Maybe I just jump to the conclusion. So what we find is obesity and chronic conditions are particularly prevalent in urban areas, affecting more the affluent groups. And for the public health people, these chronic diseases, of which now also India suffers a lot, and when I came here on the flight, I read that in India they are now also the top killers. They all require a long-term treatment, which is very expensive, either for the individual, also for the society. So I think as we bring people into urban areas, it's very important that we increase the education and tell people about the risk of unhealthy lifestyles. Because definitely urbanization can bring a lot of opportunities to improve health, so we should definitely leverage on the opportunities. And in India, you try to build smart cities, and I think these smart cities should have a big health component and should really make sure that we reap the benefits of urbanization, but also that these benefits are distributed evenly among all groups in the society. And finally, I think more research is needed to really fully understand this rather complex nexus, and so ADBI will further work on this, and hopefully we can come back with some more interesting results. Thank you very much.
Thank you, Mr. Helvey, for sticking to your time. I would just like to make two comments before we open the floor for questions. One is that although it is very useful to look at inequality, how urbanization drives inequalities,